1. So this is the first patient. You can see pre and post treatment. We use few patients, we did use the drug delivery exosomes and some patients without. You see the redness in this patient. This redness, just after the treatment, we did the exosomes. We applied topically. Because in the UK, you cannot inject. You can only use as a drug delivery. That is another important point for me. That's the reason, Brian, I love your device, Focus Dual, because it's the only way I can use exosomes in the UK, because it's not allowed in the UK to inject, but you can use as a drug delivery. Because that's important, because there are a lot of patients, they said, doctor, do you do exosomes? I said, yes. So that's the only way we can do, okay? Or dermatologist, but with the RF microneedling, it's much more superior, the results. So, go back to this patient. This erythema, you can see, this was just after, was less than 1 minute. The patient did the procedure, we did apply the exosomes, and after 2 or 3 hours, the erythema was gone. So this is another patient. We did it 3 treatments, 3 weeks apart. We did the both device. The first was the HIFU, then the RF microneedling. For her, we did use the exosomes, and you can see the improvement if you analyze. Look at double cheek. She was concerned. She was concerned about her acne scar, her texture of the skin, the pigmentation. Her confidence was very low. Okay. And guess what's happened now? She was single, now she got engaged. Because that really improved her confidence, And you can see, look, let's analyze again. Look, the double chin, it started. And look, you can see before and after, her neck. I don't know if you can see close, but the acne scar, the texture, the pigmentation. Her age, I believe, was 48. But we are finalized, so tomorrow we are probably going to send to the company the next week all the details and all the pictures, okay? We treat skin type 1 to 6. Because as a dermatologist, I like challenge. I always treat skin type 6, and I do even other devices, lasers, so I like challenge. So, and again, it's only 3 treatments, 3 weeks apart. Again, it's a tailor-made. She could do more treatments, of course, yes, but we kept this protocol, okay? That's another patient. I believe she's 49, she's a dentist. And you can see improvement before and after. You can see the jawline, nasolabial folder, so the marionette lines, better the eyes. So she feels like the cheeks is more lift as well. She was very happy with the results. She never have done any treatment. Look at the other patient. She's 52, she's a lawyer. Originally she's from Brazil, live in London. In Brazil there's a big challenge because in the past, like probably 20 years ago, it was very trendy to have big cheeks. And in her case, she put a lot of fillers, even fat. And you can see how heavy was her cheeks. With 3 treatments, you can see before and after. It's, of course, maybe she needs more treatment, but in 3 treatments, you can see we can analyze, look. Sorry. We can analyze. So if you see here, look, before, how heavy was this? Look, how deep is that you can see here the jawline. Of course, the picture, we had the chin rest, but you can see the improvement. You can see here, this is much more She lost the balloon reduction, and we gave a nice lift, a nice, more natural cheekbones. You can, I believe, she told me, she said, I look 15 years younger than before. So, again, and the good point of this, she did the treatment, I believe, was in the morning, afternoon, she was in the office. She did also with exosomes, so the redness was minimal. So this is another patient, also in the study. She has, you can see, melasma. We also did drug delivery, use exosomes. You can see the improvement on the pigmentation. Don't know if you can notice that before and after. She is also concerned about the double chin. Even she does not have, but she was telling me, oh, my parents, they have a double chin. I would like to have a treatment to prevent. So, and she was very happy with that. And you can see she has more, the jawline, more definition. So next patient, he's a personal trainer, 39 years old. He had acne scar, and PIH. So you can see also he was concerned about the jawline and the double chin. So I noticed with the youngest patients, the millennials, they are more pro prevention. So they can see their parents and do not want to look like their parents. They said, I want to prevent. Before it happens, I want to start the treatment. So also, he was concerned about the acne scar, PIH, but he wants the prevention for the double chin. And you can see the jawline get more prominent. And then there are also improvement we did with exosomes as well. You can see improvement with the PIH and the acne scar and the texture of the skin. So we use these exosomes. So this was from the placenta, because there are different types of exosomes. And that's the way, again, we cannot inject in the UK, only use as a drug delivery with Focus Dual. So that's the way we do. And we are going to do the drug delivery using exosomes. Just apply as a drug delivery. Spread as well, but to enhance the result of the treatment. Because exosomes and polynucleotides is the new trend that works on the DNA repair. That goes, it's like an envelope, go inside of the cells, and that can do the DNA repair and also the mitochondria as well, and improve the cell's metabolism. That's the reason sometimes you get improvement on the dark circles or the pigmentation as well. And it's more like regenerative medicine. So, and more patients, they start to understand that, they are aware about that, and they do want this type of treatment as well. They want to combine. So now we just finished the treatment, and we are going to do the drug. So that's the end. Again, I'd like to say thank you for Brian, Eunsung Global. And if you have any question, I'm more than happy to answer. Perfect, please. No, not at all. It was nice to interact like that. So do you have any questions?
Can you use another drugs?
Yes, absolutely. We can use, for example, if a patient has melasma, PIH, we can combine exosomes, tranexamic acid. It's one of my favorites. Sometimes vitamin C. If a patient, for example, has sensitive skin, I can use some like botanic extract. So you can use amino acid, you can use HA, you can do, you can use tretinoin, yeah. It's a tailor-made,
Hi. So your platforms obviously create acute inflammation. How do you manage chronic inflammation and make sure that your clients aren't suffering with that long term?
In terms of the just post-procedure?
Yeah,
Yes.
long-term
So
skin health.
the post-procedure is like using exosomes, because what is exosomes? Exosomes is something very new. And it's compared to, for example, to PRP stem cells. They said it's 100 times stronger. So when you use that, it's also an anti-inflammatory active ingredients. So we use that to decrease the side effect, minimize complications, and enhance the results.
And so that's just straight after the treatment?
It's straight
not
after,
long-term
yes, you saw
treatments?
the, shall we, look, this, hold on a second. Look, she just did the RF straight after, seconds. The nurse already was preparing and was just applying that. Because remember, when you do the RF, the open points in the skin, this is only still open for a few minutes. Because the moment you damage the skin starts to healing.
I understood it was 90 minutes.
90 minutes, but if it's a pen. I hear there are some studies could be only a few minutes, because 90 minutes, but remember, you have the skin, you have the enter point. So 90 minutes, maybe just the top. Do you know what I mean?
It's optimum.
Exactly, yes.
Thank you.
So, yeah. But very good question. And also, I always advise patients when I give lectures, it's very important to have the post-care. We always provide the post-care for the patients, like a special cleanser, good moisturize, and SPF, always.
Which company uses this exo?
That was an American company, so. Because exosomes, there are different types. The best one is from human. You can have from humans, animals, and vegetables, but the best one is still from humans. This is based on placentas. That is one of the reasons it's not allowed to inject in the UK yet. I know in the US, Middle East, people inject, but we follow the guidelines, the law, so we cannot inject, only use as a drug delivery. And that's another reason Focus Dual become very, very popular in my clinic. I have a question, yes.
Yes, thank you for your nice presentation. My question is about any side effect during the wound process. As you know, in the overexpression of some growth factor during the wound process, like the antiregulin, stimulated the myofibroblasts to proliferation and induce the hypertrophic scar. And do you find any kind of this side effect and among the patients? And the second question is the microsome contains many components, and as you know, there are many mRNA proteins and microRNAs, and which one is the reduce this kind of the side effect? And I think you have any tools to control the biotic process?
Okay, first question. I've been using exosomes for nearly 6 months. So far, I do not have any side effect. It's the opposite. I can see, for example, when I do the procedures, even I use exosomes for lasers as well. I do a lot of lasers, ablative lasers, CO2, Fraxel, erbium. And we are, in our protocol, we adapt the exosomes. And we notice when you use the exosomes that decrease the downtime, like redness, the erythema, redness, the peeling. So instead, maybe 3, 4 days, 5 days, sometimes it's 24 hours or few hours. But again, it's been 6 months. So far, we do not have any problem. And the second question, sorry, can you repeat that? So you ask about some protein, so?
My question is the side effect from during the wound healing process after the surgery. And the second question is the microsome.
Or microbiome.
Yeah.
Yes.
Microsome. You mean that the exosome is a microsome is the same word?
Yeah.
And my exosome produced by the stem cell or many cells, and even the bacteria produce the microsome.
Yeah.
And the exosome normally contains many proteins and mRNA and microRNA. Each one has the specific the function to control the cell mechanism, cell metabolism. So my question is how the exosome control the side effects such as redness of the surgery pattern?
Yeah, that's a very good question. That in terms of the macro aspect of the treatment, we see a decrease in the downtime, especially, like I said, the erythema. And we see the enhance of the results, because some patients, we have the groups, some they did with exosomes and some without. The group did with exosome, they felt less downtime, they felt the result was slightly better than without. Again, I've been using exosomes only for 6 months, so I haven't seen any side effect, maybe a long term, we don't know. But so far, the results we are seeing, it's really, really good, really positive. And also we sometimes combine with polynucleotides as well.
Okay, thank you.
Any more questions? So, Brian, do you want to play with the system? If somebody wants to come and have a look at the system, so...
And also our company has a booth in level 2, L211. So if there is anybody who wants to test, who wants to operate the device directly, please come and visit our booth. Yeah.
Perfect. Thank you very much, and enjoy IMCAS, everyone. Thank you.